Good afternoon, and thank you for joining us this afternoon. My name is Tina Tebow. I'm the Director of Media Relations for the Province of Nova Scotia, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Kelly Regan, Minister of Community Services, the Honourable Stephen McNeil, Premier, Nova Scotia, and Dr. Robert Strang, the Chief Medical Officer of Health. Again, we will be taking questions from the phone lines. You will each get a turn to ask one question and one follow-up. We have approximately 30 minutes. We will start now. Go ahead, Premier.
Thank you, Tina. As you all know now, we have two more presumptive cases here in Nova Scotia, and I will ask Dr. Strang to talk more about those.
Thank you, Premier. So yes, we're announcing two new presumptive cases of COVID-19 today. Both are travel-related. That brings us to a total of 14 cases in the province, 5 confirmed and 9 presumptive, as well as we have 1,373 people that have been tested and are negative. These cases are 14 cases are located in communities across the province. Age ranges in people in their 30s to 70s, and as I said, they've all been related to travel or close contact with a known case. One of our earlier cases that we announced earlier this week has been admitted to hospital overnight. They're doing well in hospital, and it's important to folks know that our health system worked well from the moment of a call to 911, EHS attending all the way through to the person being admitted to our COVID unit at the HI site and here in Halifax. Infection control was well maintained, and the safety of healthcare workers, which is critically important through this, has been upheld.
Thank you, Dr. Strang. And today, as Tina said, we're joined by Minister Regan, who is now going to share some remarks about how we, as a government, are responding to some of the most vulnerable in our province.
Thank you, Premier. Good afternoon. Today, I want to outline some of the steps the Department of Community Services is taking to support vulnerable Nova Scotians as we face the challenges brought on by COVID-19. In these extraordinary times, we need to ensure that community resources like food banks are able to continue their operations and expand their reach. And that's why government is making a $1 million investment in Feed Nova Scotia. This funding will help Feed Nova Scotia purchase food, and it will also allow this important organization to hire additional staff to support their operations. We're also committed to working closely with Feed Nova Scotia and other organizations across the province to ensure these necessary networks of support stay open. Nova Scotians are well known for helping our neighbours and for ensuring the most vulnerable are not left behind. And this time is no different. And I want to thank those who continue to step up, and I encourage others to do so if they're able. For example, consider donating to your local food bank. Reach out to your neighbours to ensure they're okay. As well, the province is investing $2.2 million to further support our income assistance clients. This emergency assistance will provide vulnerable Nova Scotians with additional support for food, cleaning supplies, and personal care items. Each individual and each member of their family on IA will receive $50. For example, a single mom with 3 children will receive $200. This is automatic. Clients do not need to apply. If they have direct deposit, as the vast majority of our ESIA clients do, the money will be in their accounts as early as tomorrow. As we monitor the situation, we'll determine when additional assistance is needed. Now, this payment is in addition to basic assistance and will not be considered an overpayment. No one has to pay it back. This investment will help approximately 26,000 families and over 40,000 people, and will be in the hands of our clients as early as tomorrow. I also want to take a moment here to thank our staff at the Department of Community Services, particularly frontline staff, as well as staff from across all government departments who are working hard to continue to provide critical support to vulnerable Nova Scotians who need us the most. As the Premier has mentioned, now is the time for us to come together as a community. The vulnerable people in our province will need our support, both from government and from all of us. Thank you.
Thank you, Minister Regan. We as a government also know this is a challenging time for seniors in our communities. That's why we're putting supports in place that will help them to continue to live safely and be connected to the community while still practicing necessary public health precautions. We are investing $230,000 in emergency funding for community links and senior safety programs. 2 existing program partners that have networks in the communities and are already connected to local seniors and their needs. This emergency funding will help those organizations increase their capacity to support those in their communities by expanding their hours and covering associated costs to deliver groceries and other necessities. Also effective today, no tenant in the province of Nova Scotia whose income has been impacted as a result of COVID-19 can be evicted by their landlord. Also today, we are also hearing from a number of universities that Nova Scotians who are students at our post-secondary institutions are still living in dorms. I can't stress this enough. If you are a Nova Scotian student, we expect you to go home. This will make it safer for those students from outside of our province who are unable to travel. For those students who have no choice, this will make their residence even safer and allow us to practice social distance. I also want to say to those who are left on campus, there's absolutely no partying or large gatherings. It is absolutely critical that you practice what public health has asked you to do, which is to have social distancing and stop large gatherings. It is important for all of us to help prevent the spread of this virus. Dr. Strang.
Thank you, Premier. So along with the new cases we announced today, I just wanted to talk about, there's just in the last few minutes, there's 2 announcements gone out about some potential exposures in our community. The first one, Nova Scotia Health Authority, we know that at a basketball tournament between March 5th and 7th at the gymnasiums at the Halifax Grammar School as well as the Homburg Centre on the St. Mary's campus, that there was a potential that people would have been exposed to COVID-19. Public Health has investigated this. It is considered a low-risk exposure. Anybody who is known to have close contact with the case has already been identified. But it's important that the community know about the possibility of a low-risk exposure. There's also been, just in the last 15 minutes or so, a release from Dalhousie University. Someone as part of the Dalhousie community has been diagnosed with COVID-19. Again, public health has been working, and anybody who's been in close contact with that individual has been or will be contacted directly by public health. Anybody else in the Dalhousie community, Dalhousie wants them to be made aware, but it's important that people understand that if they have been directly exposed, they will be contacted or may already have been contacted by public health. These are examples of how this is going to play out of the coming days to weeks. We are going to have more cases, more exposures in our communities, and at some point we will get some community spread. Cases that have been exposures within Nova Scotia, not from travel. We fully expect and anticipate that. I can't stress enough, though, that the way we control this to minimize the chances of spread within Nova Scotia, to decrease the number of people who are become infected, to minimize the impact of those who are at increased risk, seniors, people with underlying health conditions, and also to protect our vulnerable healthcare workers who are working day and night to develop plans and to be able to respond. We all need to do the things we've been talking about. The personal protective measures, hand washing, not touching your face, cleaning surfaces, staying away if you're sick, as well as the things that we did around social distancing. And I just want to touch bases on those again like we did yesterday. Everybody, we're asking, separate yourself physically. It's not a time to be together in large groups. Even if you're around other people, maintaining that six feet distance from each other as much as possible. We all need to be doing that. people, and I want to clarify, yesterday I used an example of playgrounds, which was probably not the best example. We actually want people to get out and about, be out cycling, walking, but playgrounds for young children actually aren't a good environment. Lots of kids there, lots of hands going on things that we can't control. So kids at playground is actually not a good idea, but by all means take your kids out and enjoy the spring weather that we're starting to get. People who have traveled need to self-isolate. That means staying at home as much as you can, but you can still go out and about as long as you're avoiding contact with other people. So by all means, go work in your yard, take your dog for a walk, cycle. But if you need to go to if you need groceries, if you need your prescriptions picked up, ask somebody else to do that. Communities are mobilizing to support people who are self-isolating. Don't go get your groceries yourself. And then there's also the people who are isolated or asked to be self-isolated because they are a known contact of a case. Public health works with them and monitors them on a daily basis. And then the people who are sick with very strict isolation if they're able to maintain themselves at home rather than be in the hospital. So it's important that we understand those differences, and we're important that we're all practicing what we've been asked to practice, whether it's social distancing or self-isolation for travel or other reasons.
Thank you very much. We will now go to the phone lines for questions from reporters. Again, each outlet will get one question and one follow-up question. I will go outlet by outlet to those of you who identified that you have a question for one of our panelists. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Yeah, a question for Dr. Strang. I was wondering about you said that there could be some community spread as a result of these contacts at these recreational facilities. I wasn't quite clear on that. I wonder if you can be a little more clear about why that advisory was sent.
So the advisory, there's two of them. So the basketball on March 5th to 7th, even though the close contacts have been identified, it's important that we have an obligation to inform people if they might have been exposed, even if it's a low risk exposure. They need to know that they might have come into contact and to monitor their health carefully, although they would not have been in very close contact, so their risk is significantly lower. But we have an obligation to let people know about those possible exposures. The Dalhousie one is, again, we know all the close contacts, and they have been or will be contacted by public health. Dalhousie, rightly so, wants to inform the rest of their community because there's a lot of concern and anxiety on situations like this, but they want to inform people that just so they're aware of the situation, but also to make sure that that anybody on the part of the Dalhousie community, if they haven't been contacted directly by public health, they are not considered to have been exposed and not at any increased risk.
Keith, do you have a follow-up?
So to be clear, Dr. Strang, at this point, we still do not have community spread, but I think you did say that it's fairly likely now, given what you know.
So exactly, with no community spread yet, but we just need to look in other provinces, look around the world. We have cases here from outside, and it's inevitable that we will get some community spread. It's all up to us how we work together to do all the things that we've been talking about to minimize the spread and minimize the impacts.
Thank you, Keith, for that question. Just a reminder for those of you on the phone, please mute your lines. I'm hearing a lot of background noise, so if this is going to work, it's only going to work if your lines are muted. Next question from Jean Laroche, CBC.
Hi, this is for the Premier. I just wondered, Premier, you're going to help the most vulnerable, but a number of people obviously have lost their jobs or are without any pay. How are those people going to survive, and what kind of help is the province offering them?
Well, as you know, yesterday the national government announced a major package that is supporting workers across the country, waiving the waiting period for unemployment insurance and other benefits. We're assessing that, and we will be making some announcements about programs that we as a province can do to help support that.
Do you have a follow-up question, Jean?
No, I'm good.
Great, thank you. Next, Natasha Pace from CTV. Go ahead, Natasha.
Hi, this is for the Premier. Brunswick has just declared a state of emergency. I'm wondering if Nova Scotia will follow suit And also, if we still have adequate medical supplies at this point to fight the virus.
I'll ask Dr. Strang to talk about the medical supplies, but as far as the state of emergency, no, we have not enacted one right now. Underneath the order that Dr. Strang is working on, the health order, we've been able to execute all of the things that are required. And quite frankly, our partners across the province have been supportive, from union leaders to business owners to community members to not-for-profits, have all been working with us to ensure that we do all we can to mitigate the spread of this virus. But if that changes, obviously we can enact that order. But right now, we believe what we have in place is working.
So on the medical supply issue, we have the supplies we need today, and we have a relatively small stockpile of supplies left over from H1N1 of masks and types of gloves. We are participating in a federally led common procurement process, all the provinces and territories working with the federal government to identify our material needs, whether it's through that are acquiring more respirators, also making sure that we're putting forward what we anticipate the needs for gloves and masks, other personal protective equipment. But we do have to be realistic and know that this is a global issue. There are global challenges around personal protective equipment, but we are participating in these national programs to the best we can to ensure as best we can that we have the materials that we need.
Do you have a follow-up, Natasha?
I do. I just want to be clear. So there's one individual that's now that has been hospitalized at the Halifax Infirmary because of COVID-19. Are the rest of the 13 people at home recovering?
Yes, this is our first hospitalization.
Thank you, Natasha. Again, just a reminder to please mute your phones. We will go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. This is a question for Dr. Strang. Given the potential for community spread and transmission being real, given that, I guess, what are the protocols for someone being tested now? Who qualifies? And I guess, what's the capacity to test, and how many more tests are going to be brought in?
So we're rapidly working to increase our testing capacity in the labs to up to 400 tests a day. We're also looking at ensuring we have appropriate supplies of swabs and looking at alternative types of swabs if necessary. One of the things we're also all our testing right now is driven on people who have traveled out of the province, calling 811, and then if they have the right symptoms, being directed for testing. We're actively looking at standing up some what we call sentinel sites. So we're starting to look at and get some indication of community transmission. The other thing we're engaged in, my team is right now on a national conference, and they're discussing activity in other parts of the country, and when do we potentially start to look at testing criteria of people who have come from outside of Nova Scotia but traveled within Canada.
You have a follow-up question, Jesse?
Yeah, I guess the first part of that question was, what are the protocols to get a COVID-19 test? I think there's people in the community who want to get tested. They're worried. Have the protocols changed, or what are those protocols, Dr. Strang?
The protocols are still based on travel because, as I said, as today, we do not have any evidence of community spread. Certainly the basketball tournament is concerning. We'll have to see how that plays out. But right now, all of our cases, our screening is based appropriately so on people traveling outside of the country. And so how people go about getting a test, we ask people if they're just looking for information on coronavirus, go to the government website. If they think they might need to be tested, go to the 811 website and do the self-assessment test first. That will give you direction. If people clearly fit the criteria for testing, which is travel and symptoms of fever or new cough, they are asked to call 811. 811 will take them through a further assessment and then direct them to their closest testing site. We do not want people just walking into the testing site. People need to go through 811 first, but we're also asking people, the only people who should be calling 811 are those who have gone through the screening process first, and which is online, Having said that, we also need to remember that 811 is also there for people with non-COVID related issues. So if you need to call for other health issues, by all means, call 811. But if it's about your concern, you might have COVID and might need testing, do the online screening first, and then if you're directed, then call 811.
Thanks, Jesse. Our next question goes to Cassandra Nadeau-Lamarche from Radio-Canada. Go ahead.
Hi, this is a question for Premier McNeil. We've heard reports that some provincial borders may be closing. First, is this something you have the authority to do, and is this something that you're considering?
It's not something that we are considering at all. We will continue the movement of goods and services across the country as well as into the U.S. So we have certainly made it clear to our residents that we believe this is not the time to be traveling. It's important for them to be at home. Whether or not you've been out of the country or not, we encourage people to take this time to be at home with their families as we prevent the spread of this virus. But there will be those that will be required and have to go across the country and across the borders, and we have not at all entertained the idea of preventing that.
Do you have a follow-up question?
No, thank you.
Great. Thank you very much. We will go to Chris Halef from News 95.7. Go ahead, Chris.
Thank you very much. This question is for the Premier. I just had a question regarding regulated daycares. I understand the province is offering grants and subsidies to help them out while they're closed. But just for clarity's sake, when will this funding support be available? Because I've spoken to some providers, and they say they're not sure when they're going to get it, and they feel like they're being left in the dark on this.
Well, the grant program is ongoing. They would have that now as part of their annual funding that we would provide them. What we've committed to them doing is two things. Number one is we've said no parent who has a spot currently in a regulated child care center will lose that spot. And we've said that we would ensure that government supported and funded the remaining portion of the operation that parents are paying for themselves. We don't want a parent to be paying for a spot that they're not able to use, and we as a government, because we've closed them, said that we will fund that, and that funding should be being worked out through the Department of Education and Early Childhood Education.
Do you have a follow-up, Chris?
Thank you.
Great. Next, we'll go to Lindsay Armstrong from Nova Scotia. Go ahead, Lindsay.
Hi there, this is a question for Dr. Strang. I'm curious about stockpiling medication. The Pharmacists Association of Nova Scotia expressed concerns about this as people were directed to stock up. Has this been an issue? I mean, currently Canada has about 2,000 drugs that are on the drug shortage list. Is drug shortage a concern?
I'm not aware of any acute drug shortages directly in Canada, directly related to COVID. But what we're aware of is that the potential for shortages, many of the components of drugs that are actually manufactured in China. So there's been a concern potentially that may impact the supply of pharmaceutical products here. What we are asking, while we're asking people to make sure if they have, as part of their preparedness for potentially isolating for a couple of weeks, that they have appropriate amounts of their prescription medications. But at the same time, we don't want them to be stockpiling a large amount for weeks and weeks and weeks in case we have some challenges nationally around drug shortages.
Do you have a follow-up, Lindsay?
No, thank you.
Great. Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, hi. Good afternoon. I'm wondering, the people affected by the virus who had traveled outside Canada, I know we were told the first few, but I'm wondering if you could please tell us where they had traveled to.
So we're actually being very careful about not disclosing individuals' personal information. At the same time, making sure the public is informed. It really doesn't, and from my perspective, doesn't make a difference about where a specific case traveled. We know we have COVID-19 spread around the globe, and so the whole point is that no matter where people traveled outside of Canada, they may have been exposed, and that's why we want them to self-isolate. Doesn't really matter which part of the globe they were in.
Thanks. Sharon, do you have a follow-up?
Oh, that's good. Thank you very much.
Great. Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, I have a question for Minister Regan. There are now about 800 or 900 people living in residential care settings or the adult residential centers like that. Are there any plans to move those people to community-based settings so that they can do the social distancing that they can't do in those facilities?
Thank you, Mr. Bousquet. That particular association, the association that governs the ARCs and the RRCs, is in fact has a very robust plan for events such as this. And we can certainly make the head of that association available to you if you'd like specific advice about what is happening there. What I can tell you is that in our most recent budget, we had money to move 50 Nova Scotians into new placements this year, and that ramps up to 400 over the next coming few years. So there are plans underway to do that as well.
Do you have a follow-up question, Tim?
Yeah, I guess the concern is that they're living in dormitory type situations. They have shared washroom facilities like that. And they're not even, these are not people who are criminals or anything like that. But they are not able to practice self-distancing.
Like many of our facilities, we would continue to ensure that we restrict access and people bringing the virus in. As the minister said, we're working very hard to move people into communities across the province. I actually represent one of the facilities you're referring to, and there are residents and those who believe that's their home, and that's where they want to be. And our job as government is to make sure that we provide that home is to be as safe as possible. And that's why we continue to encourage Nova Scotians who've been outside of the country not to enter these public institutions, to self-isolate. And it's also why we've taken measures in terms of some of our public institutions is preventing access because we are worried about vulnerable populations.
Thanks, Tim. We'll go to Drake Lowthers from the Port Hawkesbury Reporter. Go ahead, Drake.
My question is for Dr. Strang. I guess some parents that are maybe in custody with their children, what's your recommendation for one of them that may be working frontline healthcare and could be a vector of the virus and be asymptomatic?
So we know that asymptomatic transmission is, as the World Health Organization, who looks at the epidemiology from around the world, continues to say that it's not that it could never happen, but it's not a major contributor to transmission of this disease. It's mostly focused on people who are symptomatic. So it's a challenge to healthcare workers, and they are on the front lines in this. And we know we need to acknowledge in our communities that our healthcare workers are willing to step up and provide the care that's necessary, even if somebody has an infectious disease like COVID-19. We do have very strong infection control protocols and personal protective equipment to protect those healthcare workers, but it does put them potentially at increased risk. That then translate to what they need to do in conversation with their families. We need to focus on, though, as long as they remain well as healthcare workers, that they're not at risk to taking that back into their family home.
Do you have a follow-up, Drake?
No, I'm good.
Great, thanks. So we've got about 10 minutes left, so we'll take a few more questions. We'll start from the top again. Do you have another question? Keith Doucette, Canadian Press. We'll move along. Jean Laroche from CBC. Do you have a follow-up question?
I do. I just wondered, for the Premier's reaction to the shutdown at the Irving shipyard today, did it happen soon enough?
They would obviously be working with the national government about what the appropriate protocols were for them. They came to that conclusion today in terms of the timeline, and I think they would have been making sure that their employees would have been separated, but they made a decision along with the national government to do that today.
Do you have a follow-up, Jean?
Yeah, on the question of home care workers, do you have a bead on, perhaps Dr. Strang there, do you have a beat on whether or not those people have the equipment they need and how much longer they can continue to work the way they have been?
So my understanding is they have the appropriate equipment they need. I know my colleagues, the infection control experts in the health authority, who are actually providing their expertise across the healthcare system. They have developed robust and comprehensive infection control guidelines, both for long-term care and for home care.
Thank you, Jean. We'll go to Natasha Pace from CTV. Go ahead, Natasha. Natasha, do you have a question? Hearing none, we'll move along. Jesse Thomas from Global, do you have another question?
Thank you, Tina. This is just regards to, the call went out to have Canadians come home, and either the Premier or Dr. Strang might have a better handle on this, but do we have a registry, or do we understand how many people are coming back home to Nova Scotia? Do we have a handle on those numbers?
The national government made a call for Canadians outside the country. As you know, we began to make different steps around travel restrictions. Our border are beginning to close, other than goods and services, and trying to repatriate our own citizens. We know as a province that we're still waiting for snowbirds to come back, which will put pressure on our system. The exact numbers we don't have. And at the same time, March break is ending. But it is our hope, and I think a lot of Nova Scotians heeded the warning of the national government to come home, and we believe a lot of them have already returned, except for those that would have been away for winter vacations.
Do you have a follow-up, Jesse?
Yeah, I guess just on that note, are we doing enough testing and getting a real feel for the scope of the virus here in Nova Scotia at the moment, or should testing be ramped up, Dr. Strang?
So I think we're doing, based on as I outlined earlier, our current approach, which is the right approach based on travel. We are testing people as they come forward. As I said, we've got over 1,300 people, close to 1,400 people in total that have been tested. Out of all those, only 14 of them are positive. So, and we've significantly increased the daily amounts of tests we're running over the last week as we stood up the testing centers. We're building more capacity in our lab. We're also looking at how do we start to build some sentinel surveillance systems and looking for indicators of local community transmission. So I believe we have the right approach, and we at this time we have the appropriate capacity or necessary capacity in our labs.
Thank you, Jesse. We'll go to Lindsay Armstrong from All Nova Scotia. Lindsay, do you have a question?
I do, yes. I was wondering if Dr. Strang could update us on the progress of the nurses program of retired nurses being readmitted to the workforce.
I can't give you any details on that. That's certainly an ongoing piece of work, but I haven't been updated on that.
Thank you.
Did you have a follow-up question?
No.
Thank you. Chris Halef, News 95.7, do you have any follow-up questions? Sharon Montgomery from the Cape Breton Post, do you have any follow-up questions? Drake Lowthers, Port Hawkesbury reporter, do you have any follow-up questions? We'll now go to Geneviève Normand from Radio-Canada CBC. Geneviève, I understand you have a question?
Yes, I do. Good afternoon, Premier. I just have a question about leadership. This is very important in those circumstances. So I was just wondering what is going to happen, for instance, if you get sick?
Well, I'm fortunate. I was fortunate to be elected with a lot of capable people. Minister Regan here is with me. Yesterday, you would have had the Minister of Health has been with me a few days. The Deputy Premier's in town. We have a strong team around me, and I'm taking all the precautions, following Dr. Strang's advice. And I would tell you this province is in good shape. There's lots of people who are capable of filling in the job of Premier. And I look forward to continue to work with them. But we're also very fortunate, to be frank about this. Dr. Strang has been doing tremendous work with public health, and we've been following his advice and working with him closely.
Did you have a follow-up question?
Yeah, I was wondering if any cabinet members are under quarantine or anything like that. Are they all at work, or what's going on with your colleagues?
All of our cabinet ministers are at work, except one is actually in a self-isolation due to travel reasons, not sick, working from his home. But it's because when we imposed the travel restrictions, he was out of the country.
Thank you very much for that question. We will take one last question from Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. Just for clarification, people are confused, and I want to get the right information out to them. You have been talking about the protocols for testing, and you say there's no spread in the community, and yet the assessment tool kind of eliminates anyone who hasn't traveled outside of the country or come into contact with someone who has traveled outside of the country. So how do you know that there's no community spread?
Well, that's always a possibility, but we are based on we knew as we built our approach that the virus wasn't here. And so we are aggressively testing people who are coming into the province. We're also looking at other indicators of potential community spread all along. So we are monitoring rates of people going to emergency room with influenza-like illness, which is part of our standard influenza surveillance. And certainly if we'd seen, and we're getting daily reporting on that from all of our hospitals, if we'd seen a spike in flu-like illness in any community, we were certainly prepared to go in and do some testing. We haven't had to do that. If we got an outbreak in a school before they close, or in a long-term care facility, we would, along with our regular viruses, we would now be testing for COVID. We are now testing anybody admitted with who has to be admitted to hospital with respiratory illness for COVID. So even though we're not testing people with just fever or cough, we're looking for community spread in a number of other ways. And as I said earlier, we're actively looking at how do we start to do that more community-based in certain locations. There's nobody around the world that is testing everybody with a fever or cough, whether they travel or not. That's just not realistic or feasible. So we have to focus the resources we have on testing in the most appropriate places.
Do you have a follow-up question, Tim?
I do. Just very quickly, what is your advice for people who have seniors in their lives, maybe that don't live together? The seniors are worried about going out into the world, but the people who, the other people, are worried about going to see seniors to bring them supplies and stuff and so forth. So what would you tell people? How should that be handled?
So now is the time for people, especially seniors, unfortunately, but it's necessary that they need to isolate themselves from others as much as possible. So if you have an elderly relative, how do you actually stay connected by phone, by FaceTime? Make sure you're checking in on them, and how are you going to support them with delivering groceries? Make sure they have their medications. But certainly, even if you come in and deliver the groceries, making sure you're staying well away outside of that 6-foot distance. And we're also asking communities to do this. Not all seniors have family around them. So how do communities working together? I'm hearing lots of this already happening at just almost kind of at an organic level. Communities are stepping up and knowing where they may be seniors, but they may be vulnerable in other ways. And how do we actually help those people stay separated from the rest of us while they get their essential needs looked after? And it's physical separation, not social separation. And I can't stress that enough. We have lots of tools available. We need to stay apart physically, but we actually need to focus, even increase the way we reach out and connect with one another virtually.
Thank you very much, Tim. That's all the time we have for questions. Premier will close it off.
Thank you, Tina. And thank all of you. I do want to just emphasize again that if you're a Nova Scotia student at a university in our province, staying in a dorm, we expect you to go home. We need to continue to make sure that we do not spread this throughout our province. And the best thing you can do is go home to your home community and allow those students who have to stay on campus to have more opportunity to have a broader space. I also want to say to Nova Scotians, thank you for the tremendous cooperation that you've been providing us as a government and public health. Continue to remind your loved ones who are still out of the country or coming home, they have to self-isolate for 14 days, no exceptions. We need them to self-isolate. It is the single biggest thing that each of us can do for one another. Is to go home, stay there for 14 days, and practice good hygiene. And to follow up to Tim's question, the other thing that we can do is look out for our neighbors. If we know someone in our community that is living alone, pick up the phone and call them. Ask them, do they need you to pick something up at the grocery store? Support them. Do what we always do. Be kind to each other, and we'll find our way through this. Thank you all.